So welcome to our revision session. Today we're doing a very important topic, that is in surgery, a common asked question under acute abdomen pain. So by the end of this video, you should be able to explain or outline, you should be able to define pain. You should be able to state the causes of pain. You should be able to explain the types of pain. And you should be able to explain the physiology of pain. So pain is unpleasant sensory and emotional experience associated with actual or potential tissue damage or described in terms of such damage. Pain is a sensory process of detecting actual and potential tissue damage. Pain can be classified as mild, moderate, and severe. Most causes of pain can be chemical. So in terms of chemicals, we know what chemicals are. So when a chemical is produced, it can cause nerve irritation. Okay, it can cause nerve irritation, hence resulting into pain. We can have trauma. So trauma, when there is trauma, when there is tissue damage, okay, this will lead into nerve exposure. As a result, chemicals will be, as a result, the nerves will be irritated. Okay, so burns, um, there is a burn. When there is a burn, this can lead into exposure of the nerves. Okay, can lead into exposure of a nerve on the burn surface area, which may result into nerve irritation. We have cord. So under cord, in a case where the body reaches a state where it's not in an optimal environment, okay, in an optimal body environment, okay, so this can lead into irritation of the nerves. This can lead into irritation of the nerves, resulting into pain. Okay, so uncomfortable environment. So let's say here's a person who's facing stigma, or here's a person who maybe lost something that they loved or somebody they loved. Okay, so this can be traumatizing to this person. Okay, this can traumatize them psychologically and also mentally, resulting into pain. Okay, also infection. So in a case of infection, we know what an infection does. So let's say in the body we have got an infection. Those infections will be producing toxins. Okay, so the toxins will go to the nerves and irritate the nerves, resulting into pain. Okay, so let's quickly jump and look into the types of pain. The types of pain. So I've got the first type of pain. So the first type of pain that we have is idiopathic pain. Idiopathic pain. So under idiopathic pain, this is a pain that has got no definite cause. Okay, so somebody's in pain, but we don't know where the cause is. That's what we call idiopathic pain. And then we've got pain number 2, which is psychogenic pain. So this is a pain that results from psychological, emotional, okay, psychological, emotional, and intellectual damage. Okay, so in a case where somebody is psychologically disturbed, okay, in a case where somebody is psychologically disturbed, in a case where somebody is psychologically in a case where somebody is psychologically disturbed, you'd find that they may undergo through stigma. Okay, so let me give you an example of, let's say here's somebody, let's say, or let's say in case of child abuse or child neglect, in other words. So here's a person in terms of being stigmatized. Okay, being stigmatized. So after that, being stigmatized, that can cause trauma to their psychological state. Okay, so as they will be in that state, that can result into the same psychogenic pain. Okay, the same psychogenic pain. So it's mostly results from psychological disturbance. So psychological pain is sometimes called psychogia. Okay, psychogia, or it's also sometimes called psycho somatoform. Okay, it's also called somatoform. Okay, so this same psychogenic pain, it can also result into headaches, as persons thinking too much about such situations. The situation is not okay, somebody feels not wanted. Okay, so this can result into this can result into other problems like back pain, stomach pain, okay, and also headaches. Okay, so as they're thinking too much, it can also result into that one. And then we have got the neuropathic pen. Neuropathetic pen. So neuropathetic pen, this is a type of pen. This is a type of pen that results to damage of the nerves, okay, or the nervous system. Okay, so it could be the central nervous system, it could be the peripheral nervous system, or sometimes it could be both. Okay, so the pain that results into damage of the central nervous system is what we call neuropathetic pain. And we have psychomatic pain. Okay, oh sorry, somatic pain. So under somatic pain, this is a type of pain that results from damage damage to tissues of the organ or tissues of the body. Okay, so it could be tissues of the bone, it could be tissues of the skin. Okay, it could be tissues of the muscles, it could be any type of tissue. Okay, it could be any type of tissue. Okay, so that's what we call somatic pain. So somatic pain can be deep or superficial. Okay, so let's say if a cut is deep down there, that's when we classify it as a deep somatic pain. Okay, but if it's a superficial, let's say on the skin, that's what we call superficial somatic pain. Okay, so any part of the body that is damaged, any tissue in the body that is damaged, is what we call somatic pain. Okay, and then we have number 5, which is visceral pain. Visceral pain. So a visceral pain, this is a type of pain, that results from hollow organs or internal organs. Okay, so let's say organs such as the heart, the liver, kidneys, intestines, even inside the blood vessels. Okay, so any organ that is resulting from an hollow organ is what we call visceral pain. Visceral organs that mostly have hollow structures, and they produce a pain is what we call visceral pain. Visceral pain. Okay, yeah. And then number 6, we have nociceptive pain. Nociceptive pain. So nociceptive pain, this is a type of pain that mostly results from irritation of the nerves. Okay, on irritation of the nerves, that's the peripheral nervous system. Okay, yeah. So in a case where the nerves, the sensory nerves, in other words, when we talk about nociceptives, we'll be talking about receptive nerves. Okay, so nerves that receive pain. Okay, receive pain. So if there's any irritation on those nerves, is what we call nociceptive pain. Okay, and then we have number 7, which is referred pain. Referred pain. So under referred pain, this is a type of pain. This is a type of pain that is felt on a distal area from the site of stimulation. Okay, so let's say in a case where we've got for example, we've got a liver problem. Okay, so for a liver problem, you hear it on the shoulder part. Okay, you hear it on the shoulder part. And then in a case where I've got a cardiac pains, in a case where I've got cardiac pains, you won't hear the cardiac pain on your anterior chest cavity. Okay, but you hear the pain on the posterior part on the posterior part. Okay, just okay, so you hear the pain on the back part of you. Okay, so that's what we call referred pain. That's what we call referred pain. So referred pain from the organ, now distant part. Okay, on a distant part, that's why you can hear this type of referred pain. Okay, and then we have number 8. Number 8, we've got phantom limb pain. Phantom limb pain. So this is a type of pain that a patient that may have undergone an amputation or a body part has been removed feels. Okay, so a pain that maybe somebody goes on an amputation, a pain that somebody goes an amputation and then they feel this pain is what we call a phantom limb pain. Phantom limb pain. Okay, so we also have number 9. Number 9, I've got chronic pain. Chronic pain. So this is a type of pain that has got longer duration. mostly it's more than 6 months. Okay, that's what we call chronic pain. Okay, chronic pain. And then we've got acute pain. So under acute pain, this is a pain that has got a shorter duration of time. Okay, it's short net. Okay, doesn't last long. That's a acute pain. Okay, so we quickly touch the physiology of pain. But in some cases you'd find they say the physiology as the transmission of pain. Okay, but in this case we're going to look at the physiology of pain. Okay, so the physiology of pain, basically we talk about the movement of pain. Okay, from the site where you pick the pain, the transportation that it will go through the nervous system until it reaches the pain, until it reaches the brain interprets and then transmits back, is what we'll be talking about in this case. Okay, so it's a transmission. In other words, we can call it the physiology of pain. Okay, so firstly we've got nociception. Okay, nociception. So under nociception, these under this phase you'd find we've got so in this phase, so pain is picked. Okay, pain is picked by the sensory nerves. Okay, so after pain is picked by the sensory nerves, okay, so in short, by the in nociception, under nociception we've got nociceptors. Okay, nociceptors. So nociceptors are simply the nerve endings that are found on the superficial part of the body. Okay, we've got the skin, and then just down there, what makes you feel when you touch yourself are nociception. Okay, nociception, nociceptors, not nociception, nociceptors. Okay, so after you receive that after pain is being picked by the nerve endings, it is converted. Okay, it is converted into electrical impulses. Okay, it is converted into electrical impulses. Okay, it is converted into what? Electrical impulses. From electrical impulses, it will be transmitted. Okay, it will be transmitted. Okay, from the sensory nerves to the relay nerves, so in the relay nerves, as they'll be transmitted again to the body, okay, they'll reach the brain. After reaching the brain will reach a point where it will perceive the pain. Okay, it would what? Perceive the pain. So there'll be interpretation of those impulses by the brain. So after they've been interpreted, okay, so using past events, the body itself will reach a mechanism where it will try to cope up with that pain. Okay, so in other words, it will start producing what we call um, opioid opioid effects. Okay, so it will start produces what we call opioid effects. Okay, so opioid effects will be involvement of the neurotransmitters which will help to inhibit the pain. That's what happens in moderation. Okay, so that's what happens in moderation. So in moderation there will be now inhibition of pain. Okay, inhibition of pain. Okay, so let me just take it a little bit slow so that we understand. Okay, so in nociception we've got nerve endings that will pick the pain. In transduction, so the pain will be converted into electrical impulses. Okay, will be converted into what? Electrical impulses by the help of chemicals like histamine, bradykinin, okay, and prostaglandin. So they'll be converted into nerve, okay, will be converted into electrical impulses. And then in transmission, those impulses which were converted will move, okay, what will move, okay. The impulses will move from the site of transduction to the brain, okay. So in three segments. So we have the peripheral nerve tissue, okay, the distal horn of the spinal cord, and also the brainstem, the thalamus, and also to the cortex to process the pain, okay, to process the pain. And then in perception, you'll be talking about if you had the similar experience of that pain, there will be, if you had a similar experience of that pain, the body will use that experience to cope up with such a pain, okay. So let's say, for example, we all know how an injection prick feels, okay. So the body itself is kind of has that memory of how the injection prick feels, okay. So using previous memories, previous events, the body will interpret that pain, okay. And then in the last one, moderation. So in moderation, the body will try to inhibit the pain, okay, inhibit the pain by producing an opioid effect, which will be, okay, which will help to inhibit the pain, okay, by producing opioid effects which will help to inhibit the pain, okay. So basically, when we'll be talking about the management of pain, we know that one, it's based on the cause, okay. But one, we can give analgesics, we can give analgesics based on the severity of the pain, okay. Based on the severity of the pain, we can give analgesics, we can give fluids, okay. We can give fluids in cases of sickle cell crisis, okay. So we can give fluids, and also be in a quiet environment. That would help. Be in a quiet environment as well, position the patient in a comfortable position. That would help to manage the pain, okay. So basically, that's what we had for you. Thank you and stay blessed.